Good evening, everyone. My name's Jonathan Cannon. I'm the have the honour of being the head of school at Ramaz, and I'm delighted that so many of you have joined us this evening as we do our responding and really express our appreciation to the medical profession, the multiple frontline people who are working. Beyond in our, I was speaking to somebody who said 24/7 is just our base start for the work that we find we're having to do at the moment. So people are just working like day in and day out, taking risks for themselves, separating from their families, and really doing it because they care. And we can look up, and I look up in awe at the work that you do. And so we started at 7 by thanking all of our medical workers and all of our first responders across the country. It's now picked up in multiple places. We have an opportunity tonight to recognize three Ramaz alum who've been particularly involved, and it's really a point of pride that we welcome you here this evening, and representing yourselves, also representing the many alumni of Ramaz who've gone into the medical profession to do the work that you're doing, and also representing the whole profession. And if you take anything from tonight, even though you're going to be presenting to us, it's a very strong message from the hundreds of people who've joined us to speak to you, to say really thank you to you and all of your colleagues for what it is that you do from the Ramaz community and beyond. So our three alumni who are joining us this evening, you can probably, I'm going to say their names, and you can probably tell from, they've all written their accurate names underneath them. So actually, it's not like one of our classes where the kids all flip names and you then have to work out who's who. So Dr. Andrea Zimmern, she's a graduate of the class of '96, works as a colorectal surgeon currently at North Shore University and Long Island Jewish Hospitals, Long Island Jewish Hospitals, and that's part of the Northwell Health Network. I could read out a biography, but to tell you some of the key points, and some of you may come up with other things in question, but Dr. Zimmern is extremely involved in resident and medical student education, has had several articles published, including in the National Colorectal Cancer Roundtable Brief, which she wrote on guidance for advanced polyps. And in addition to surgery, Dr. Zimmern is very involved with fellowship programs and serves as a mentor for residents, and also is a faculty member of the school that works on initial clinical experience for first year medical students. How do you eat, I guess, would be the question for you. Let me also introduce Dr. Alex Peyser. Alex is a graduate of the class of 2006, chief resident in obstetrics and gynecology at North Shore University Hospital, and also at Long Island Jewish Medical Center. And as you can imagine, during the past weeks, Dr. Peyser and all of her colleagues have been splitting time between taking care of patients on the labor and delivery wards that continues as it always was. And I guess the big question is, in 9 months' time, are we going to see a surge in that, or how's that going to play out? But also having to do some serious work in the intensive care unit. And Leo Esses, Leo, who's a graduate of the class of 1990, joined Hatzalah of the Upper East Side in 1995 as an emergency medical technician, has personally responded to thousands of medical calls over the last 25 years, was a first responder to the World Trade Center attack in 2001, and also treated passengers of US Airways flight 1549. Over the past few months, Leo has played a leading role in the Hatzalah emergency response, providing particularly obviously medical care and emergency transport for COVID-19 patients. In his spare time, Leo is a practicing commercial litigator and works for the Esses law group. So thank you all really very much for joining us. Just to give you an advanced heads up that Alex has to leave just before 8 o'clock to go on her shift. So if it's your question, we ask her just when she leaves. It's not personal. It was just timing. But maybe Dr. Peyser, let me start by asking you, how is the world of obstetrics and gynecology affected by sort of this parallel universe or this overarching universe of COVID-19?
So for us, it's, all about protecting the mom, the babies, the support person. So when this first all started, we were concerned about that. So we were screening and restricting support person based on patient symptoms. However, this has changed overall. We're now screening everybody that comes in, and a support person is able to be with the mom during the labor process. It's really postpartum that we've been restricting fathers, support persons, to limit the number of people in the hospital. But for us, we are wearing full protective gear when a patient is delivering. At the beginning, when a mom was by herself, it was, scary. We were the ones supporting them during the labor process, and it's unfortunate that their partner wasn't able to be there. But slowly we're making strides, and we're seeing a lot of progress with our labor rooms. Our postpartum unit had to be shifted to a different area. We now have that back because of the number of cases that are being discharged. So we're seeing definitely an improvement in that.
Thank you so much. Dr. Zimmern, I guess two questions. How's your own practice work being impacted by COVID-19? But also fascinated that you work with so many people new to the profession in mentoring and in lecturing. How is becoming new to the profession in this time, how's it impacting students, and how's it different?
So actually, before the governor mandated that we stop doing elective surgeries, Northwell decided to stop doing all elective surgeries a couple of weeks before that. So as a surgeon, our practice pretty much came to a halt. And we ourselves decided to close our office for half the week. We were only seeing emergencies. We really just wanted to limit our staff's exposure, because back then we really didn't know who had it, who didn't. People weren't getting tested. Our staff was freaking out. People were having breakdowns in the middle of the office thinking they were going to get sick and die. And so it was really scary, and we just decided to kind of stop what we were doing, full stop. So most of the surgeons are starting to lose their minds because none of us have been operating for about 6 weeks. The flip side to that is that the patients themselves have also had to wait. We've had a lot of frantic or, anxious emails and phone calls from patients that they're, very anxious to get their surgeries done. And we understand, but there's really nothing we can do about that. I mean, I could talk forever about the impact on the surgical world, but basically about 60% of the surgeons in our health system were redeployed in other capacities. So I myself have been working in one of the COVID ICUs. Some of the other surgeons have been helping on the regular floors. Other surgeons have been helping in more administrative roles, trying to get the system up and running again to be able to start doing surgery again. So we're all kind of in our own world. I haven't seen my partners in 6 weeks. We're just kind of doing our own thing until we're told that we can get back to what we love doing. As far as the med students and the residents, the med students actually were pulled from clinical rotations. So they have not been in the hospitals helping us for their protection. They don't need to be there. They don't need to be exposed. So that decision was made on the med school's end. The residents have been, I think second to the nurses, who are just angels. The residents have been our workhorses. They are taking care of all these patients. Our surgery residents are taking care of these medical patients. It's not anything that they're trained to do, but they picked it up and started doing it, and they really have been absolutely incredible. We couldn't be able to take care of these patients without them. And we're still trying to provide some education. We're doing some Zoom lectures like everybody else in education in America. So we have been doing some Zoom lectures for our residents to try to keep up our educational curriculum, but it's been a challenging and interesting time for them, and they're stressed and they're working long shifts. And even though their hours are actually less than what they're used to working, the hours that they are working are very heavy and just, yeah, it's been an interesting time.
Thank you so much. Leo, I guess you've worked in many different scenarios. It sounds like you've handled many emergencies. How does these last few months of COVID fit in? What's been different? And also, do you have sufficient resources? Are you finding that your members of your own team are becoming unwell and have to be out? How's it all working at Hatzalah?
Well, as it compares to other times that we've had to run into action on what I call non-regular calls, this is different because unlike 9/11, which very traumatic, after a few weeks, things sort of kind of got back to normal and we went on our regular calls. After, any incident they're short-lived for the most part. It's not to say that we don't have lasting, reactions to it, but, they come, they go, and you go back to your normal life. What we're seeing here from the beginning, and I think for quite some time from the EMS point of view, is something that's going to be long-lasting. PPE isn't going away in a few weeks when the world reopens. From an EMS point of view, I think that we will always worry about patients having COVID. And a call for difficulty breathing may indicate a COVID patient, but we could also have a patient who's having a heart attack, is having a stroke, or just having abdominal pain, or God forbid, broke their leg. That also potentially is going to be a COVID patient for us for a long time. So, in terms of, PPE and wearing our protective gear, that's something that's going to become normal for us. So how we're all going to react in the long term towards that, I don't know. But right now, and I know many members in Hatzalah, very strong people, very strong, and they're taking it in stride, and they're taking it the way they should. In terms of our resources, thank God, we have coordinators on the Upper East Side that take care of us very well, and have gone and done whatever they needed to do to make sure that we're protected. We have the masks, we have the gowns, anything that we need, we get. And thankfully we have that, because as Andrea and as Alex do, we all go home to our families at the end of the day. So thankful for that we have all of our protective gear. But, it comes at literally a monetary price.
Thank you. And I'd like to invite everybody who's attending. On the bottom of your screen, there's a Q&A button that you can click that, and then you can share your own questions and things that you want to ask our group, and I'm then happy to ask them on your behalf. I did want to ask Leo, has there been an increase in volunteers for Hatzalah, decrease? Has it impacted that flow at all?
Well, thankfully, we always have people that want to join Hatzalah. In different areas, they have different requirements in terms of who can join and not. I think right now, there are definitely people who say they want to come and they want to participate, but we have to be careful. Just like Andrea said, her residents, and you don't want to throw them in the thick of things yet. You want people who are experienced and know how to handle it, because it's no longer just running up to a patient and taking a blood pressure and examining them and getting history and doing everything we do. Now everything we do is not that doesn't take thought. It takes a lot of thought. But now what we do takes even more thought. In terms of contamination, putting on gloves, how you take off your gloves, how you get in the ambulance, how you get out of the ambulance, so on and so forth. We want the experienced people to help us now, but we're always looking for the next people who are going to come and going to help us.
Oh, thank you, Andrea. How is it? Everyone wants to help, and all of us want to do something. We can't do what you do. We don't have that experience, and if we tried, we would mess it up terribly. You have an expertise and excellence and a quality. What are the most impactful things that people are doing that have the most meaning for you in terms of helping out or contributing something?
I mean, any gesture is meaningful. I think that, you know, we're surrounded by such devastation all day, every day, and even just the smallest thing is so appreciated. You know, we joke at the hospital that there's endless pizza. I mean, there's just pizza everywhere you look, but because people want to help, like you said, and they don't know what to do, and they know that they can send us food, so they send food, and it doesn't go unnoticed. We are so thankful. We have very little time to take a break to eat sometimes, and the fact that that's there for us, and, you know, somebody thought enough to do that for us. I was telling Kenny yesterday when we were talking about this, one of my fellow Ramaz alums from my class, who I haven't seen since we graduated a long, long time ago, reached out to me and said that he saw on Facebook what I was doing and asked for my address. And a week later, I got a package in the mail with, you know, a foot massager and some hand balm, which is the best thing anybody ever got me, because washing our hands and Purelling our hands 100 times a day, my hands are dry. I mean, that probably was one of the most touching things that anybody has done. We're not, you know, close. We haven't seen each other, and he just did that, and it was amazing. So, yeah.
Alex, are you seeing any change in the number of patients coming through ICU? Is it stabilizing? And somebody asked, you know, what kind of numbers does one ICU manage sort of over the course of a few months, or how many people are in it at any one time?
I think Andrea can answer the ICU numbers. I can answer the labor and delivery numbers in terms of seeing positive patients. I think we're definitely seeing a decrease in the number of positive patients. We originally were seeing about 15 to 20% asymptomatic positive patients, and now it's slowly downtrending. So that's something positive. And Andrea can answer about the ICU.
Yeah, Northwell actually probably in the country is taking care of the most patients of anywhere. And I think at the max, we had about 3,500 patients in-house at one time, total patients. I think at the max at our hospital, we had about 400 ICU patients, maybe something like that, which is just an astronomical number. And I don't know if that means much to everybody, but you know, on a normal day, I can count on one hand the number of ICUs that we have, and we created 12 extra ICUs at just one hospital to be able to care for these patients. I think right now we're down to like 100 and something patients on ventilators. Still an incredible amount. I mean, the ICU that I've been in is 23 beds, and all of them are intubated on ventilators. And it's just, even me, I'm used to seeing sick patients in the hospital, and it's something I've never seen before. So still, the ICU patients are lagging behind a bit. Overall, it's getting better. We're definitely seeing less admissions to the hospital. We're going back to having a lot of non-COVID floors. But the ICU, unfortunately, is lagging behind. Those patients are staying there for a long time. So it's going to be a little while longer before the ICUs kind of are decanted and open back up again.
Thank you. And then I'm sort of going to come to Leo and then Alex as to what is the most, what are people doing and how are they contributing in the most helpful way in the areas of work. So Leo, let's see.
In terms of contributing to us, you know, all of our members are stepping up. You know, these are people who are getting up, leaving their families, going on calls day and night. And it's, as I said before, you know, it's a lot more intense than it usually is. But then they go home. And, you know, you have to worry that every patient is a COVID patient. So that means we have to wash our clothing. We have to, you know, when we pretend, you know, we're going home to our families, you know, after an hour or two of going to the hospital, if we take them to the hospital, but going on the ambulance. You know, so contributing our families in supporting us and letting us do this. Also contributing are the people who help us, you know, who donate money to us. And then just honestly, the biggest contributors are the people who call us for real emergencies. There was a point in time, which I know everybody knows, you know, the fire department was saying they were getting almost double the normal daily calls. Well, Hatala was getting 4 times the amount of calls it usually gets in a day, starting the end of March, going into April. It was nonstop on the radio, listening to calls all over the 5 boroughs. So in terms of people just calling us because they have a real emergency and not calling us where they used to for things that they weren't sure about, but that's a huge contributor to us, to help us. And I just want to be clear, everybody should always call if they think they need an ambulance or they want to get checked out. But we appreciate those who, who say, you know what, it's not that bad. And we're talking about boo-boos and stuff, we can let them go to the more serious calls.
Thank you. And Alex, what's been the most impactful for you or what are you seeing that's the thing that gives the most help or is most useful and appreciated?
Yeah, I mean, back to what Andrea said, having everyone just support us. The 7 o'clock cheer obviously is really impactful. And the food donations are amazing. We have an alumnus, Rachel Schnee, who set up this whole organization, Feed Our Gems, where she collects money and orders food from kosher establishments who deliver it to everyone in the hospital who needs a meal. And she just sent me a meal on Sunday and it made everyone's day. And we were so full, and it just, it's really nice. And she posts on Facebook and Instagram, and it just brings everyone together, and it's really special. Thank you.
I think it's probably a question, at least to start with, for Dr. Zimmern, for Andrea. I'm now sort of channeling questions that are coming in the Q&A. So we're reading a little bit, or that it appears in children more than people imagined that it would. Are you seeing that at all, or?
I mean, we don't deal with kids, so I don't know that I'm the best person to comment on that. Maybe Alex knows more about that through the OB world, but yeah, I'm not really sure. I have seen the same reports, but I don't have any inside scoop on that.
Thanks. Okay. Alex, are you seeing anything?
In terms of the newborns, I know the pediatricians have been testing any baby that is from a positive mom, and the first reports out are nothing substantial. Has been no positive babies at this point. Obviously, there still needs more to be done. I did hear from a pediatric ICU attending last night, who was my attending in the ICU overnight, that she was seeing these children, Kawasaki cases in 15-year-olds that had positive antibodies for COVID. So that's sort of new that she mentioned. I don't really know much, but I did hear that.
And well, I've got you. One of the questions we've had is are you seeing any impact on postpartum depression, giving birth on sort of in this time and under these circumstances?
Well, I think moms are definitely scared and frightened. It's still early to tell, and honestly, I'm not seeing so much outpatient. I'm really in the inpatient world right now, so I don't think I could answer that at best, but we're going to definitely have to follow that.
Right, and yeah, I can imagine that there's a level of anxiety and loneliness. There aren't the people to rely on that you can often rely on being surrounded. From Leah, are you seeing any change? As we listen to the governor, sort of there's a message that slowly there seems to be less calls, less people going to hospital. Is that come through to emergency services at all yet, or are you seeing it plateauing?
Yes, over the last week or so, we've seen the numbers in terms of the number of calls per day come down dramatically. We're getting back to relatively where we were before. We're still a little bit more than we are on average, but we're getting back to more normal numbers. What we found is that people are scared not to call us. People are scared to go to the hospital because they hear all these stories, and they're not sure whether they want to go or not, even if they're having significant medical conditions. Slowly but surely, these people are going to start calling us. And, my suggestion is, if you have something that you normally would go to the hospital, you try to do it, but it's a very tough decision by these not only by the patient, but by the family members, because not only do we have to drop off the patient by themselves in the emergency room, but we also have to take them from their family, from their homes. Typically, we have family members come in the ambulance with us and accompany their family members in the emergency room, and and so forth. Now they're not allowed in the ambulance, and they're not allowed in the emergency room. So we're leaving, patients, especially the older patients, by themselves. And that is a very, my personal opinion, it's a very significant mental issue for these patients that have to deal with this on their own.
And somebody's written in, that there seems to be almost, as people are hearing that things might not be as bad as they were, people are beginning to take, not medical people, the people who live in New York and elsewhere are beginning to take more liberties with the kind of physical distancing, and you kind of see them grouping themselves together in ways that might not have happened 2 weeks ago, because there's this sort of relief. I mean, what are the messages you want to send about physical distancing and the impact or otherwise that it's having on positively when it's being done properly, or negatively when it's not? I throw that one open to anybody who'd like to jump in.
I mean,
No, Andrea, please.
I was just going to say, it's obviously working. We're seeing a decline in the cases. The question is obviously how to get back to normal, which who knows what normal is going to be. But, it's a little disheartening to see people ignoring these orders when we know that it's important. But at some point, we're going to have to get back to being around each other, to some degree. So, for now, the rule is still that you're supposed to wear a mask outside, which I think people should, because it helps. And, if we have to go back to where we were 5 weeks ago, it's not going to be good. Yeah.
Thank you. And I don't know if Leo, did you want to add something to that? Or?
I couldn't have said it better than Andrew did.
So someone should start. I guess that is such an important question, but never really thought about it. I mean, obviously, if you're calling 911 or you're bringing the emergency services, it's one thing. But if you feel unwell in a way that you might normally have gone to an emergency room, let's just say, you've got pains in your chest or something like that, what should you do? Should you just get in a car and go? Where should you go? Are there particular hospitals to go to and place? What does one do if you kind of would have the kind of situation where it's serious enough that you just go to the emergency room?
So one of the things, generally speaking over the last 25 years, but particularly over the last few weeks, is people have my cell phone number and they call me and they say, I'm feeling this, I'm feeling that. Should I go to the hospital? What should I do? Andrea and Alex can speak much more authoritatively on the issue of what are the symptoms of COVID-19. But from what I'm reading is there are a lot of things we don't know yet. And so, from the COVID-19 perspective, don't assume anything is or isn't COVID-19. And, you just go with your gut as to whether, you should go see a doctor or go to the hospital. In terms of the example of you gave chest pains or anything like that, my suggestion is forget about the virus. Just, call us, call Hatzalah, we'll come, we'll check you out. And if you need to go to the hospital, we will take you to the hospital. And that's what you should do. In terms of the emergency rooms, again, totally different than the ICU units upstairs. We've seen that the emergency rooms are not nearly as bad as they were 4 or 5 weeks ago. They have room. It's not overflowing. That obviously changes day to day based on other issues. But the answer is, if you think you need an ambulance, you think you need to go to the hospital, call us, and we will come.
Or just go to the hospital.
Or just go to the hospital.
Our ER has, I think, its lowest numbers in recent history. It's that low because the COVID numbers are dropping and everybody else has stopped coming in. And we get patients asking all the time, when I'm on call, I get calls about people who need to be in the hospital and they're so scared to go to the ER because of COVID. And, we try to reassure them that they keep them separate. We try to, the hospital made a big effort to make separate entrances for COVID versus non-COVID, and to try to keep people separate, to try to protect people who don't have it. But if you have something that needs to be taken care of, please, please, please go to the hospital, because we're starting to see the things that were not urgent are now becoming urgent, and things that were urgent are now emergencies. And we never want to let it get to that point.
And when I've got you, Andrea, what somebody's asking, when Northwell, I guess anywhere, imagines that it's going to go back to elective surgery again.
So the state has mandated that until May 15th, we cannot do anything that's considered elective. So there's no way around that, Northwell or otherwise. After that, assuming they allow us to start doing that, we've already started setting things in motion to start to get back to doing surgeries. We have, the health system has about, if I'm not mistaken, about 10 to 15,000 cases backlogged that we haven't done. And they had to come up with a way to prioritize those. So right now we are allowed to do things that are urgent. So they're doing urgent cancer cases, time-sensitive cases, ophthalmology cases where somebody would otherwise lose their vision, things like that, that really can't wait. They cleaned out one hospital in Long Island that is now our non-COVID hospital. The hospital is completely empty, and that is now where we are doing these urgent cases. So we're starting to get back to normal, but it's still not normal. We're not operating in the hospitals we're used to operating at and with the staff we're used to operating with, but it's just a way to start getting things done. So little by little, we're getting there.
Thank you. Alex, people, somebody's written in, but I can, we hear the expression PPE and we know what the letters stand for, but we're not always sure exactly what that is. I mean, what do you have to put on when you're delivering a baby? How does it look different to what might have been 6 months ago?
So for a vaginal delivery, it normally would be a gown and a regular mask with a shield and a hat. The only difference really for vaginal delivery is we're putting on an N95. Mm-hmm. So we're being.
Can you explain what that is? Because that's another question from the difference between an N95 and any other form of a mask.
So from what I understand, it just protects from smaller particles and decreases the amount that comes through with that mask. So we wear the N95 and we wear a mask over that as well. But every time we deliver a COVID patient or even a vaginal delivery, we actually are supposed to get a new N95 because of all the exposure that we get. In terms of a C-section, it's also just an N95 that's extra. We were wearing everything else otherwise.
And do you get the sense that there's enough sort of equipment and N95s to go around? Is it?
Yeah, me and Andrea were talking yesterday. We are really fortunate in our health system to have that available to us, and they've been really great at giving it to us when we need it.
Thank you. And somebody's asked, I guess I can throw it out to anybody because this will affect you all in different ways. Hopefully it doesn't. If there's a second wave, which I guess, do you sense now that there's enough equipment in New York, enough space, enough ways to handle it? Obviously it took everybody somewhat by surprise, or do you think that if there's another repeat of what you've seen in the last few weeks, that's going to put an unbearable strain on resources?
As you started asking that question, my stomach dropped, because the thought of doing this all over again is
I realized that. Yeah.
I don't know. I think the one thing that we are going to run out of is stamina. Our manpower, our staff, we are exhausted. We are in every way possible. I mean, emotionally, mentally, this is probably the medical challenge of our lifetime. And we have thrown everything we have at this. We've just been go crisis mode from the beginning, and we're doing it, and it's working, and we're taking care of the patients. But I think that the strain it has put on our health system from a personnel perspective is the thing that I don't think we'll recover as quickly. We can buy more masks, we have ventilators, we have beds, we created 1,000 new beds overnight. That's the easy part. I think that the staffing is going to be the bigger issue.
You know, I can't begin to imagine the human toll that it's taking on all of you and on everybody that works. And I guess that's why the repeated appeals for people to take seriously the preventative measures which we can take to slow it down, to stop it, and again that message to everybody that keep that physical distancing, take it seriously. We can't do what the medical teams can do, but we can try and create circumstances where you're less likely to have to go through what it is. And I certainly I wish it wasn't the medical challenge of your lifetime, but I certainly hope that now it's happened, it is, and that nothing nothing goes beyond that. Is there any knowledge yet, and I know all of you are kind of probably learning as much as the world is learning, but is there any sense of whether or not, you know, there are antibodies being built up, and the sense of how you manage somebody who's had COVID versus somebody who doesn't, or is the assumption still that that anyone who's had it, you've got to treat them as if theoretically they could get it again? I don't know if that's. I think I've asked that question right.
I think, you know, just from the EMS perspective, for those, and there are Hatzalah members who have had COVID, and some of them have been, you know, in the ICU. Some of them, you know, thankfully have not had to go to the hospital. But we treat whether an EMT has or a paramedic has had COVID or not. You know, they go full PPE on every call. We're not taking advantage of the fact that they may or may not have antibodies. You know, we treat it like we want, you know, like they never had it. So the antibodies from an EMS perspective on Hatzalah is not a factor in anything. Except, I want to be very clear, I'm sorry, except to give plasma.
Right, fair enough. A question that's coming up in multiple different forms from multiple different people is, it's not really a question, it's a statement. People are just in awe, and we're not giving everybody a voice because of the way a webinar works, that people have a written voice, but it's just person after person after person is writing in to say how you know, we can't thank you enough. We cannot even imagine somebody's wording what it is that you go through, what you've given up in terms of family, what they've had to give up in terms of allowing you to do the work, what it means. And there's no words of thanks that are sufficient, but everyone's trying to find their way of really saying that. And I guess a question that somebody's put towards the end of that is and maybe Andrea, it's a question you can answer, but I think everybody can answer it, all three of you in your own way. Was this something that the concept of I guess a pandemic is an extreme word, but the in terms of epidemiology and training, was there enough of it when none of this existed, and do you imagine it's going to change the way training takes place? I mean, how many people are kind of feel qualified, how many people are operating just as doctors do, like dealing with it because it's there?
None of us were ready for this. There's no amount of training that would have made us ready for this. I don't think any of us could have imagined a scenario where we'd be functioning in capacities completely outside of our training. And the one thing I will say, the kind of constant theme across everyone that I've worked with in the hospital, and it's one of the more positive things that's come out of this, is that, you know, and I'm sure Alex can say the same thing, working in the ICU, we're working with people we never would have worked with before. You know, people from all different specialties all over the hospital. I never would have met these people. And we've all been working together in these ICUs. We're kind of thrown together in this mishmash. But I think most of us would agree that, you know, we went into this to help people. And when this all started and they were asking us to help and do things that were not necessarily our normal jobs, it wasn't even a question of whether or not we were going to do it, because we're not going to sit at home. There are people who are sick who need to be helped, and I'm sitting at home doing nothing. That just seems wrong. And so I'll help however I can, even if it's in a you know, lesser capacity than I'm used to. So we were not prepared. Hopefully we will be prepared now that this has happened. Certainly at a health system level, they have, you know, protocols now in place to deal with this if it does come back again. You know, there's a second wave, third wave, 100th wave, whatever it may be. But we've all learned something to some degree.
I'm just reacting to something that you said because it's so humbling. You know, you say it and you mean it as if it's the most obvious thing in the world. There's people to be helped, so we're going to go in and help them. And if we have to help them in a different way to the way we were planning to help them, that's obviously what we do. And it's just very humbling to hear that and to know that thousands and thousands of medical professionals are taking. That's who you are. That was the oath that you took. That's the commitment that you made. And I know you say it like it's the most natural thing in the world. It isn't the most natural thing in the world. It just teaches us all the importance, and it reminds us all the importance of giving. I don't know if Alex, you know, you sort of Andrea said you might have thoughts about that as well in terms of how your training didn't prepare you, and you know, what would you recommend for if the next level of faculty came to you and said anything we should change? What would be
I mean, we definitely were not prepared for this. I'm supposed to be finishing my residency in 6 weeks and wasn't expecting to finish it off in the ICU. But as Andrea said, I went last night to the ICU and you see, you know, all these people that I was like, oh, I know you, you're the tech from the OR. And I see her and she's helping one patient, and I see another nurse from a different unit, and everyone just together helping the patients. And it was really a humbling sight to see and to watch everybody just take care of these patients. It's really humbling.
And Leo, in and amongst all of your team's incredible work and acts, have you seen anything that stood out? Is there a hero? You know, you're all ours heroes, but is there something that stood out for you, something that you've seen which was just extraordinary, even in the work that you do?
Well, I think I have the Hatella heroes, and then I have another hero. The Hatella heroes are the guys who, you know, go out on 3, 4, 5, 6 calls at the heart, you know, when everything was going haywire, and you know, dealing with, you know, 5 or 6 or 7 patients in a row who literally were, you know, close to their last breath. You know, they did everything they could to help these people and to transport them to the hospital, to do it over and over and over repeatedly in a short time period. Those are my heroes on Hatella, the guys that do that. The other hero I have is my family, because they didn't sign up for this. You know, in Ramaz, you know, my senior year, I could join Hatella or I could be on the hockey team. And I chose the hockey team. But when I came back from college, I had the opportunity to join Hatella, and I did that. And that was my own decision to do. And I had no one to ask permission to do it. Now, you know, things are different. You have a wife and you have a family. Bring this potentially into the house every time you go on a call. So, you know, our families that we go home to every night, those are also our heroes.
And ours too. So thank you. And Alex, has any act, anything stood out for you, even in amongst these incredible sacrifices or commitments that everyone's making?
I mean, for me, it's really the paradox. We have an ICU shift, and then 2 days later, we go up 3 floors amongst all the sadness. We go into a delivery room and bring life into the world. And it's, you know, really just something positive that gets us through this tough time.
And Andrea, anything that stands out for you, even and above?
Yeah, you know, there's no one thing or one person. It's been a lot of, you know, my friends will tell me like, oh, your posts on Facebook are so great, they're so uplifting, and that's just because we're trying to focus on the positives. You know, is there's so much negative, and it's so easy to just get sucked into that and get really sad. But we're trying to focus on the positive. In honor of Nurses Week, which is this week, I'll say that the nurses are far and away my heroes. I mean, these people are just magical humans that are, I mean, the unit I've been in and a lot of these like makeshift ICUs we've been in are not real ICUs. They're no rooms for the patients. It's one open space. So when these nurses get all gowned up and masks and everything, and they're in there for 12 hours and they're doing everything for these patients, and these patients are completely alone, their families aren't there, and they're basically the patient's family, and they're holding their hands and they're FaceTiming with their families for them, and they really are just exceptional. If anybody out there knows a nurse, just give them a hug. I mean, they're really, for anything that you think a doctor's doing, the nurses are doing 15 times more.
Thank you, and I think that's an important thing for us to know, and I think we all do know nurses, so it's a reminder for us to reach out and acknowledge that. This is I guess a difficult question. Not for you. We have one of our people who's viewing the webinar who's quite elderly and is anxious and saying, are there words of comfort that you can offer? Are we getting better at doing this? Is it they're just feeling very nervous, and they're in awe of the three of you and what you're doing, and just looking for some strength, and wondered if you have any words of wisdom or that there are to share.
It's getting better, little by little. We're the day closer to finding a treatment, some way to fight this thing. And there's so many smart people out there that are researching this, and there are clinical trials, and every day we learn something new about this disease, things we have to look out for, ways that we can better treat it. So there are little wins every day. It may not seem like it, and you may not hear about it in the public, but we see it every day. Some way that we came up with to treat a patient maybe a little bit better. So we're getting there.
Thank you. And Alex, I know you've got to drop out, but we're going to wrap up in a couple of minutes soon. But is there any thoughts you've had as part of this conversation? Anything you'd like us to know that we may not have thought of? I mean, it was hearing about the nurses so important. You hearing about the people just moving from ICU and then delivering a baby and then they're back in ICU, or the really thinking about what it means to be a family member. These things are important. But just generally, as we wrap up, and I know you have to go and do God's work again, and anything that you'd like us to know, or that we might not have asked you about, but is important.
Yeah, no, it's been a privilege to just be able to be there for these patients, for moms, fathers, the babies, and bring life into the world during this time.
Thanks. And I guess as we wrap up, to all of you, we have the phrase "Ramaz cares," and we mean it. I know in the caring profession, sometimes there's two forms of caring. There's what we can do for you that makes us feel better about having helped you, but that might not necessarily be the things that actually make a difference. So for us, caring is about, and this is why so much of tonight has been illuminating, emotional, and so is the depth of insight you've been able to give us as to what you do. And I think that when we talk about Ramaz caring or Ramaz responding, it gives us a window into what that really means that we do, and how we can be helpful and thoughtful. I mean, you guys are deep in our hearts every minute of every day, but that we know that's a starting point, but we really are understanding a little more and a little insight, although we just know how much larger that is. So in thanking you, I wanted to ask you, I know Alex, I asked you ahead of time in case you needed to slip away, but But Leo and Andrea, Leo, do you have anything that's anything continuing that's important for us to know, helpful for us to know, or that you just want to say, you want to make us aware of? That's why
Well,
we're
first
here.
of all, I want to thank the community for their support of Hatzalah always, and especially, now. The biggest thing, obviously, anybody can do for us is two things. One, pray for us, not only Hatzalah, but for Andrea and her team, and Alex and her team for the great work that the two of them are doing. So that's the first thing. And then, to give the pitch, the way to support Upper East Side Hatzalah is to make a donation, and it is very much appreciated because, as I said before, from the emergency response perspective, we're going to be wearing protective equipment for the foreseeable future, and that's a significant additional cost to what our normal operating budget is of the ambulance and all the other equipment that we have. So that, and then I'm going to hopefully embarrass them a little bit. Andrea and Alex, because as you said a little bit ago, Jonathan, they become the family of all the patients that they take into their hospital because their family can't visit them. And they do amazing things. Andrea said the nurses do it, but Andrea and Alex also do it. I know they do. So thank you guys for that. It makes my life a little bit easier in dropping off the patient by themselves, knowing that you guys are upstairs.
And to just piggyback off something Leo said, I know it from hearing it, don't underestimate the importance of financially supporting the work of the people who are on the front lines, whether it's just a tiny little bit or a bit more. There's all kinds of very non-financial ways to care, and they're so important and they're so valuable. And there's also extraordinary needs of the hospitals and the and Hatzalah and the emergency services, and of families who themselves have suddenly found themselves impacted by a loss or by an experience or by their work that they do, which may have nothing to do with medical, but that's just disappeared on them. So I don't think we can underestimate the need to support the organizations, and for any of us who can, to step up in any way that we can, alongside all the other multiple ways that we can give support. And Andrea, I'm gonna give you the closing word, echoing Leo's thanks to you, to Leo and to Alex. You are all stepping up as the families of these people. I don't want to leave you out of that, Leo, even though you said it. You go as somebody's family in the back of an ambulance or driving the ambulance. That's when they expected somebody else from their household to step in with them and hold their hand on the way to the hospital. And that's what you and your team do. And let's not underestimate that. And say, thank you to everybody. And Andrea, I don't know if you have a parting thought.
No pressure, right?
No.
So again, thank you to everybody that supports us. So some of your points, if you do want to donate, it's amazing. If you want to give us food, that's amazing. If you want to give to somebody who really needs food, there are tons of people out there that are hungry because they lost their jobs and can't afford food. If you want to donate, there's tons of food banks and Feed America and all sorts of organizations that you can donate to. People ask all the time about donating PPE, donating masks and things like that. Like Alex said before, thankfully we are very lucky to work for a health system that has the capacity to get us those kinds of things. The city hospitals do not as much as we do. So if anything, they probably need it more than we do. But another kind of word of hope, like you had asked for before, if God forbid you do have a family member that comes to the hospital, please know that we are there. We're doing our best to take care of them and to let them know that we're there with them and they're not alone. It's not the same as having their family there, but we're doing what we can. And if you do have a family member that's at North Shore LIJ and you need one of us to try to be in touch with them, I'll speak for myself and say I'm happy to. I'm sure that other people would as well.
Well, thank you. Well, it sounds like we'll keep that pizza rolling in, and the kosher meals rolling in, and taking care of families whose one of their members has gone into the medical world. But we're also in any way we can, we have your backs, because you've got the backs of the people who really need it right now. And Ramaz is proud to be a part of it. And I think I speak for me, but I think I speak from the other Ramaz representatives. You know, however much we think we might have known, we listen to the three of you, and we know so much more, understand so much more, and that you chose to use your time, which is very limited, and which could have been spent doing multiple other things, that you chose to share some time with Ramaz is very important. I want to promise you that our job is to respond to that in ways that make your life easier and that of you and your colleagues. There's nothing more important that we could be doing right now. So really, thank you very much for joining us. Thank you so much to our attendees, as well as our support group. Kenny, I don't know if you have any.
Well, we want to thank you,
words,
Mr. Cannon, for leading this tonight, and we are so very, very proud again of Dr. Andrea Zimmern, Dr. Alex Peyser, and now we can even say, in many ways, Dr. Leo Esses, in the work that he's been doing. I just want to remind everyone that it is officially Giving Tuesday now, which is a time to recognize and thank all those who are serving on the front lines and raise money for the COVID relief, which you've just heard about some ways to do it. And at Ramaz, we created the Ramaz Responds in order to stand together as a community and show our appreciation for the many, many Ramaz members, some of whom you met tonight, who have responded to the COVID crisis with compassion, creativity, and care. So please visit the Facebook group, Ramaz Responds. That's the way it's written, Ramaz Responds, and read and post and read about our Ramaz heroes. And we heard from 3 of them tonight, but there are already 20 or 30 of them that have posted, and please join us in posting. And we always want to recognize and say a refuah shlema to those who are ill and suffering from COVID or from any illnesses. And we extend our condolences for those who have lost family and friends during this terrible time. And again, thank you all for being with us tonight. And please join us for many of the other things that we do together as a community during this very difficult time period. Take care.